Uses. Amoxicillin is used to treat a wide variety of bacterial infections. This medication is a penicillin-type antibiotic. It works by stopping the growth of bacteria. This antibiotic treats only bacterial infections. It will not work for viral infections, such as common cold, flu. Using any antibiotic when it is not needed can cause it to not work for future infections. Amoxicillin is also used with other medications to treat stomach, intestinal ulcers caused by the bacteria H. pylori and to prevent the ulcers from returning. How to use Amoxil oral. Take this medication by mouth with or without food as directed by your doctor, usually every 8 or 12 hours. The dosage is based on your medical condition and response to treatment. Drink plenty of fluids while using this medication unless your doctor tells you otherwise. For the best effect, take this antibiotic at evenly spaced times. To help you remember, take this medication at the same times every day. Continue to take this medication until the full prescribed amount is finished, even if symptoms disappear after a few days. Stopping the medication too early may allow bacteria to continue to grow, which may result in a return of the infection. Tell your doctor if your condition persists or worsens. Side effects. Nausea, vomiting, or diarrhea may occur. If any of these effects persist or worsen, tell your doctor or pharmacist promptly. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Use of this medication for prolonged or repeated periods may result in oral thrush or a new vaginal yeast infection, oral or vaginal fungal infection. Contact your doctor if you notice white patches in your mouth, a change in vaginal discharge or other new symptoms. Tell your doctor right away if any of these rare but serious side effects occur: dark urine, persistent nausea or vomiting, stomach, abdominal pain, yellowing eyes or skin, easy bruising or bleeding, persistent sore throat or fever. This medication may rarely cause a severe intestinal condition due to a bacteria called C. difficile. This condition may occur during treatment or weeks to months after treatment has stopped. Tell your doctor right away if you develop diarrhea that doesn't stop, abdominal or stomach pain, cramping, blood, mucus in your stool. If you have these symptoms, do not use anti-diarrhea or opioid products because they may make symptoms worse. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching, swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. Amoxicillin can commonly cause a mild rash that is usually not serious. However, you may not be able to tell it apart from a rare rash that could be a sign of a severe allergic reaction. Get medical help right away if you develop any rash. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Precautions. Before taking amoxicillin, tell your doctor or pharmacist if you are allergic to it, or to penicillin or cephalosporin antibiotics, or if you have any other allergies. This product may contain inactive ingredients, which can cause allergic reactions or other problems. Talk to your pharmacist for more details. Before using this medication, tell your doctor or pharmacist your medical history, especially of kidney disease, a certain type of viral infection, infectious mononucleosis. Amoxicillin may cause live bacterial vaccines, such as typhoid vaccine, to not work well. Tell your healthcare professional that you are using amoxicillin before having any immunizations, vaccinations. Before having surgery, tell your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, this medication should be used only when clearly needed. Discuss the risks and benefits with your doctor. Amoxicillin passes into breast milk. Consult your doctor before breastfeeding. Interactions. The effects of some drugs can change if you take other drugs or herbal products at the same time. This can increase your risk for serious side effects or may cause your medications not to work correctly. These drug interactions are possible, but do not always occur. Your doctor or pharmacist can often prevent or manage interactions by changing how you use your medications or by close monitoring. To help your doctor and pharmacist give you the best care, be sure to tell your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products, before starting treatment with this product. While using this product, do not start, stop, or change the dosage of any other medicines you are using without your doctor's approval. A product that may interact with this drug is methotrexate. Amoxicillin may cause false positive results with certain diabetic urine testing products, cupric sulfate type. This drug may also affect the results of certain lab tests. Make sure laboratory personnel and your doctors know you use this drug. This document does not contain all possible drug interactions. Keep a list of all the products you use. Share this list with your doctor and pharmacist to lessen your risk for serious medication problems. Overdose. If someone has overdosed and has serious symptoms such as passing out or trouble breathing, call 911. Otherwise, call a poison control center right away. U.S. residents can call their local poison control center at 1-800-222-1222. Canada residents can call a provincial poison control center. Symptoms of overdose may include severe vomiting, persistent diarrhea, a severe decrease in the amount of urine, or seizures. Notes: do not share this medication with others. This medication has been prescribed for your current condition only. Do not use it later for another infection unless your doctor tells you to. With prolonged treatment, laboratory and/or medical tests, such as kidney and liver function, complete blood counts, may be performed periodically to monitor your progress or check for side effects. Consult your doctor for more details. Missed dose. If you miss a dose, use it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Use your next dose at the regular time. Do not double the dose to catch up. Storage. Store at room temperature according to the product labeling, away from light and moisture. Different brands of this medication have different storage needs. Check the product package for instructions on how to store your brand, or ask your pharmacist. Keep all medications away from children and pets. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product when it is expired or no longer needed. Consult your pharmacist or local waste disposal company for more details about how to safely discard your product.